call communities have a lot of participation in the widely available prevention and screening programs that we have in Australia. And because they don't participate at the same levels, they are more likely to be diagnosed with cancer at a later stage. And this has significant implications for both prognosis and their treatment experience. So importantly, who we are and where we come from influences how we view our health, and importantly, it influences how we understand and respond to cancer. This timely, accessible, relevant information so that the polled patient is just as able to get the information they need when they need it, and in a way that's accessible to them and understandable by them as the non-called person. And if I can have a second bite at the cherry, provision of that emotional support, that help with the fear, that help with the anxiety, that help with what's going to happen next. That applies regardless of what culture you come from. But getting that when English isn't your first language and when you're not so sure about cancer, that's really difficult. If we can provide that timely, accessible, relevant information together with saying, this is the emotional support we can provide you. We'll help you through this journey. We'll help you with your anxiety. We'll help you with your fear. We'll help you with your depression. Then I think we're doing a much better job at supporting called cancer patients.
Across various populations, family members and friends, who are often referred to as informal caregivers or carers, we know that they play a pivotal role in the diagnosis, treatment and management of cancer for people who've been diagnosed. And so these family members and friends can play an important role in driving people to and from hospital, asking questions during appointments, communicating with doctors, as well as making key decisions about treatment. And we also know that family members and friends are critical in the home care setting, so managing symptoms and side effects. They can also provide practical care, medical care, as well as provide social, emotional, and psychological support for people who are diagnosed with cancer. Whilst this caregiving role can be quite rewarding for people, we also know that it can be quite stressful, demanding and burdensome. And this can also impact negatively on the caregiver's own health and well-being. And this is because these caregiving roles is often managed alongside existing responsibilities, such as managing work, family, as well as the household. And for caregivers of people from called communities, they can take on even greater responsibilities, especially if the patient has English as a second language. And so these caregivers often take on the role of interpreting and communicating between providers and patients, and they can take on the role of managing all of the patient's appointments. And so we know for people from core communities, there can be cultural beliefs, attitudes, as well as taboos around a cancer diagnosis, as well as around death and dying. And this can all impact on people's understanding and preferences about how they manage a cancer diagnosis and the treatment. And so we know for people from core communities, there can sometimes be stigma around cancer. So people might not want to talk about the diagnosis with their extended family or with their friends. And this can lead to barriers with being able to seek formal or informal supports. So not talking about the diagnosis with their family members and friends can also impact people's own health and well-being if they don't have people that they can trust and to talk to and have support for themselves. Caregivers had a lot of unmet needs, and so it's that support from health providers and clinicians about the information that they might need, the types of supports that they think the patient needs, and so really being able to feel supported by various health providers in that particular role is quite important. But also they have a lot of unmet psychological and emotional needs, so it's about enabling caregivers to access the supports and services that they might need to address these psychological and emotional needs that they might have as part of caregiving. These themes that have emerged include caregiving as an individual responsibility. These caregivers have a sense of not wanting to burden other people. And there's also a theme around challenges with understanding and accessing health information for caregivers. And there's also different perspectives about supportive care and supportive care services that are available for caregivers. In this first theme, there was caregiving as an individual responsibility and really not wanting to burden others with their stress or their worry in relation to caregiving. So for example, with the Chinese male caregiver who was looking after his mother with kidney cancer, he really talked about how he didn't want to share his caregiving role or any of the burden with his wife, and that he didn't think it was their business, and he didn't really want to bother his immediate family or extended family about what was going on with his caregiving role. And so for a Chinese female who was looking after her mother with head and neck cancer, she was quite reluctant to talk about her situation with her friends. And so she wasn't sharing with her social circle. And she spoke about not being very open to talk about the situation with her friends. There was also a sense of stoicism, the belief that you have to go through this situation yourself and that no one else could really help you. And for another Chinese male caregiver who was looking after his sister with cervical cancer, he really spoke about not talking with his friends or family about the diagnosis or treatment. And for them, they actively avoided talking about the cancer. And this was because there was a sense of stigma around. So it would be bad luck or bad fortune if they spoke about it. And if they talked about the cancer, there's a potential for it to return. Studies have shown that some cultures adopt a very fatalistic view of chronic diseases such as cancer. And so particularly for the older generations, if they hear that they've been diagnosed with cancer, then they automatically think that that's a death sentence. And so they're not going to accept the potentially life-saving treatment for them, even though we've had medical advances and they could still live a very long and full life. I think that points to the importance of having formal interpreters during the appointment sessions to make sure that that information is conveyed accurately. Sometimes there's a bit of cultural sensitivity around the word cancer, but then also need to present the information accurately as possible. Talking about improvements needed as well as the power of advocacy. These are quotes from a female Arabic-speaking caregiver. She really spoke about health providers being sensitive to culture and how people might want things done or how they might want information to be presented. She felt that it was important for caregivers to have that cultural sensitivity when they were speaking with her and her husband. But also, I think there was some frustrations that there was some important news that was provided to the patient and she wasn't there in the room, but the doctor just sort of went ahead and gave that news. And so I think it was just more about including the family in that sort of decision-making and sharing of the news. But she also mentioned there were very positive aspects with their healthcare and they were treated exceptionally well because there were advocates, so advocating on his behalf and making sure that the supports and interpreters were available at the time.
That's really important. It's like, is the interpreter just a machine that goes in there and repeats back like a sort of subtitle for the doctor? Or are they someone who has a bit of an advocacy role? But the best communication will only occur when the patient can feel they can trust the interpreter. So trust is really critical in the communication pathway. So to the extent that the interpreter is involved in the communication between the health professional and the patient, there needs to be a sense of trust. And as the interpreter rightly pointed out, establishing trust just by walking in the door is a difficult thing to do. So I think that's one of the sort of challenges that we probably haven't given much thought to before.